things can happen after delivery. You could have eclampsia. Eclampsia is basically fitting.
Oh, she's having an eclamptic seizure. Look, I'm going to take her for a C-section now.
I've heard of horror stories whereby they saw a woman throwing fits and they felt that it was an evil spirit that was at work. So I want to share about my personal experience regarding postpartum hemorrhage, which is bleeding after delivery. So after I had my second child, I started feeling the urge to push again. Prior to that, my delivery was super fast. My whole total labor was about 47 minutes of active phase. However, I had induction of labor because of preeclampsia. Preeclampsia is basically high blood pressure in pregnancy plus protein in the urine, which usually occurs after 20 weeks of pregnancy. Mine started in the late trimester. I was already around 37, 38 weeks before my blood pressure started rising. Ab initio, they recommended I start aspirin, but because I'm not a medication person, so I didn't take the aspirin and then I was like, well, I had preeclampsia in my first pregnancy, and having preeclampsia in your first pregnancy basically puts you at risk of having preeclampsia in a subsequent pregnancy. It's quite high. So, however, I didn't have mine till around towards the end of third trimester. So now let's go back to the delivery gist. So after the delivery, I started having the urge to push again. So my husband was just at the corner in the room, and I said, Mide, it seems as though there's still another baby in here because I'm having the urge to push again. At that time, the nurse was taking care of the baby because I had the baby in the theater. It was in vaginal delivery, but because his heart rate was decelerating, they said I needed to go to the theater so that they can bring the baby out. But fortunately, as I got to theater, I felt the crown and I said the baby is here, and I pushed out the baby by myself. And they asked if I wanted to cut the umbilical cord. I'm like, yes, I will cut it. So I severed the umbilical cord myself. So I'll just be there, here and there. Sorry for the digression. So now back to the urge to push. At some point, I couldn't hold the urge to push. And as I just pushed, there was just this lump of blood that just came, boom, like that. And the nurse who was taking care of the baby, as soon as she saw the gush of blood, she just pulled the alarm bell, and everybody just rushed in. Like, one was like, it happened really fast, and it was traumatizing. At this point, I was already crying because it was painful. So one of the interventions that they did was to do a bimanual massage, such that there was a hand that just went into the birth canal. Remember, I just gave birth, so everywhere was quite sensitive. And then there was another hand on top of my womb doing like manual compression. Whilst they were doing that, they were giving me jab of oxytocin on my lap, and they rolled me over very quickly to the side, and then they inserted misoprostol right into my back passage. They passed urinary catheter